Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our special guest today is Dr. Patrick Bitter, a board-certified dermatologist specializing in non-surgical treatments to improve skin health and delay skin aging. Dr. Bitter is regarded as a pioneer in the use of pulsed light technology for skin rejuvenation. We'll be back with our interview after this brief message from our sponsor.
Hey there, listeners. It's your host of the weekly podcast, Redefining Medicine. I have a question for you. How much time do you spend ordering functional lab tests for your patients? Ordering from multiple lab companies for hundreds of patients can quickly turn into hours of admin time. But there's a new way to order lab tests that I'm excited to share with you. Rupa Health is a tool that lets you order 20 plus specialty labs in a single portal. You can order all tests you normally do from companies like Dutch, Vibrant, Genova, and Great Plains, and so many more. Imagine you're ordering a hormone panel for a patient that includes tests from 3 different labs. You have to log into 3 different websites to place separate orders and then come back weeks later to check tracking number and download results. Rupa eliminates all of that by having all ordering, tracking, and results in a single place, and they also handle invoices, tracking shipments, automated follow-ups, personalized instructions for completing tests, and so much more. The best part about Rupa, it's free for all practitioners. Go to rupahealth.com, that's RUPA health.com, to join a live demo or sign up to see how it works. Now let's get back to today's show.
We are so happy today to welcome Dr. Patrick Bitter to the A4M podcast. He's a board-certified dermatologist specializing in non-surgical treatments to improve skin health and delay aging and anti-aging medicine. He is also the founder of Advanced Aesthetic Dermatology. So welcome, Dr. Bitter. It's so nice to talk with you today.
Thank you, Melissa.
Of course. So what made you get into the anti-aging field of medicine?
Well, I started my training in medical school at Stanford in the late 1970s, early 1980s, and preventive medicine was really very much in its infancy. Stanford had a Stanford heart disease prevention program, and so as a medical student, I thought that's what I wanted to go into, and that was going to be really what my mark that I was going to leave in the world was teaching people how to live a better lifestyle and live healthier lives. Turned out back then, which is now 40 plus years ago, that heart disease prevention was really mostly focused on people already diseased and not the healthy group of people. So when I first had my experience with the American Academy of Dermatology back in about 2005, it was like nirvana for me. It was people with knowledge about wellness and about vitality and about longevity and bringing that knowledge to students like myself. It really fired up my passion and early interest in being healthy. Again, at that point, I was already a dermatologist, so it was really kind of a adjunctive interest to what I was doing in dermatology. But over the years, being involved with the offerings from the American Academy of Anti-Aging Medicine and understanding that the members really also had an interest in what I was doing, which was in cosmetic medicine, aesthetic medicine, in helping people look good, they realized that there is really a very natural marriage between people that want to feel good and also want to look good.
Great, wow. It's been quite a journey for you. So what would you say the value anti-aging medicine brings to the field of medicine overall?
I think that for me, it was particularly what is offered through the A4M, both in the annual meeting that they put on, as well as the numerous offerings and the podcasts, is gathering information that is contemporary, is up to date, it comes from experts that you can apply to your own life. So I've been an athlete my entire life, and as an athlete, I've focused on nutrition and other things that athletes need to do to compete at a high level. But like every human being on earth, we're all aging, and I'm aging as well. And where things maybe seemed really easy to do when you were 25 and 30 and 35, like going to an Ironman at 25 with hardly any training, it's not the same when you get to be 66. And so whatever nuggets of wisdom about supplements and sleep and healthy lifestyle that I've been able to gain, I've been able to apply to myself. And then I can share that also with my patients that I see in my practice of cosmetic dermatology, because I see people seeking me out to want to look good, but that same population wants to feel good. And when many of them are younger than I am, and they look and they say, Dr. Bitter, you look great, and we saw your, we follow you, and we saw that you did this event or that event. What is it that you do? It allows me really to share a lot of what I've learned from A4M over the last 15 years.
Wow, that's so interesting. So let's talk about the fact that you're 66 and you don't look it. And what healthy habits do you partake in that keep you looking the way you do?
Okay. Well, my personal philosophy is what seems to be the overriding theme of A4M and of wellness and anti-aging medicine, and that is balancing things in your life. And I think that what I've learned as a doctor for 40 years is that the healthiest people who have the greatest vitality at the advancing ages that they become are people who have figured out how to balance things in their life. They get enough sleep, they get enough exercise, they have fulfilling relationships, they get enough sex, they eat the right things, they take the right supplements, and it really begins to show. We can get away with a lot when we're in our 20s and 30s, but it eventually starts catching up with us. When you live a life that's out of balance, and we're surrounded by Americans that are out of balance, people that are 50 and 100 pounds overweight, people that by the time they get to be in their 60s are hunched over, people with really sun-damaged, wrinkled, aged-looking skin in their 50s. These are people that have made lifestyle choices, and gradually they catch up with them and they look out of balance. Learning what it is that you need to do to balance those things in your life, as I said, with respect to sleep and diet and nutrition, are really vital. And then, of course, my area of expertise is what I've learned to do with the skin, and in particular, using light. What I spoke about earlier at the World Congress and shared with the audience was really what has been my area of expertise in the rejuvenation of skin and the anti-aging of skin. And well, I practice what I preach. So I do regular light treatments on myself and a little bit of filler here and there and a little bit of neuromodulators, and use certain skincare products to have my skin age more slowly.
Okay, well, great. Would you mind giving us an overview of what you spoke about today at the 29th Annual A4M World Congress?
Yes, I'd be very happy to, Melissa.
Thank you.
I was invited to speak on a topic that really is what I mostly spend my time doing, and that was the artistry of combining what you can do with light to rejuvenate skin and delay skin aging and keep skin healthy with injectable fillers and injectable neuromodulators that people know best as Botox. And that's what my practice is. I see 15 to 20 people a day, and largely that's what people come to see me for, is the artistry that I've developed over the years with using light for treating people's skin. The light that I use is BBL or broadband light, and then using fillers and using Botox and other neuromodulators to relax. And my focus has really been paying attention to what my patients have wanted, which is to look natural, not to look like you've had something done. And that has been my philosophy, that's been my approach. And what I shared with the audience in my presentation was really some of the pearls that I've learned with light treatments and with fillers to make faces look more attractive, knowing how to create volume in a face, making cheeks look nice, a jawline looking more youthful, filling in lines, and the techniques that I've developed over 35 years of using fillers to fill in and erase upper lip lines and sleep creases that people eventually get sleeping on the side of their face. And then how I've learned how to use Botox or other neuromodulators to give people natural results. And that now is my practice, and I love what I do.
I know you're giving another lecture as well tomorrow. Would you mind giving us an overview of what that topic?
Oh yeah, thank you for asking. So I will be speaking and sharing with the audience really the state of the art of what we know about broadband light, how we've learned to use broadband light to correct a whole variety of conditions that people have: acne, aging, sun-damaged skin, uneven pigmentation, sunspots, rosacea, redness. Broadband light has proven really over the years to become a very powerful tool for correcting skin. And then I'll share with the audience how you use broadband light to make skin healthier anywhere on the body. And in using broadband light in the specific ways that I've developed over the years to be able to have skin not only look nicer, but also be healthier and function healthier. And then I'll share with the audience how you use broadband light to slow down aging. So the presentation I'll give will be a much more in-depth on the special techniques of using broadband light and really the many different benefits broadband light has for all of us. And whether you're a cosmetic dermatologist like me or really a doctor specializing in anti-aging medicine, this technology, broadband light or BBL, has a really invaluable role for all of us in offering the benefits of light to people to keep them healthier, keep their skin healthier, and slow down aging. And at the end of the day, it's really what everyone wants. We want to look good and we want to feel good as we get older.
Wow, truly amazing. So, if you could be known for one thing, what would it be?
Wow. Now you're having me really think. I think I would like really people to think of me as the practitioner that brought his passion for wanting to help people look their best, have the nicest, healthiest looking skin, and his curiosity about this magical light-based technology called BBL, and his interest in listening to people, his passion and curiosity to his practice, and then what I've learned from my own patients about what light can do for them and what people want, and shared that with the world. So if anything, I'd like to really be, I think, remembered as the doctor who brought love and light to the world.
That's a great answer, love and light. Well, thank you so much for all these tips and tricks.
Oh, thank you,
It was
Melissa.
a pleasure talking with you today.
My delight. Thank you very much.
Thank you.